Thank you. Thank you for inviting me to speak today. I'm a physiotherapist at the Ottawa Hospital, and I've been working for the last 5 years with the Champlain Falls Assessment and Streamlined Treatment Clinic. So falls are what I'm really interested in preventing and educating people about. So I'm happy today to start with that. Okay. So today I'm going to talk a little bit about why falls are important and why you should care. And then falls and the effects on health. And then as well, why people fall. So what we call risk factors. So things that contribute to an eventual fall. So as well, I'm going to provide some extra tips for what you can do to reduce falls for people who are living with dementia. So what is a fall? So a fall is not a normal part of aging. The risk is higher with aging, but it's not a normal part of aging. And the definition of a fall from the World Health Organization is, as you can see there, an event that results in a person coming to land on the ground inadvertently, the ground or the floor, with or without injury. So if you weren't planning to be on the ground, if you weren't on the ground to be picking weeds or cleaning the floor and you ended up on a lower surface, then it's a fall. And as well, what's important to be aware of is a near fall. So near fall are those events where you might feel like you're going to fall is imminent, but you avoid it by some kind of action, whether you grab onto something, grab onto somebody, hold onto a wall, or have enough reaction time to catch yourself from falling. And it's really important to think about these near falls because often they're a warning sign that something is up, and if something is done to reduce your chance of having another near fall, you can reduce your chance of having a fall. So these are some of the responses and results of a fall happening over the years. So obviously the falls get more serious as you get older. People do fall sporadically through life. A lot of falls in sports. If you watch a soccer game, there's falls all the time. But the incidence and the risk increases with age, and that consequences increase. So what we know, true or false, injuries from a fall are 5 times higher if you're over 65. In fact, it's 9 times higher. 50% of falls have a minor injury, but almost a quarter can have a serious injury. And falls cause 90% of hip fractures. The average Canadian senior would end up staying in the hospital for an extra 10 days with a fall-related admission rather than any other cause. And someone with dementia more likely to sustain a serious injury following a fall rather than one of their peers. So these are grim but realistic stats, but there are so many things that you can do to reduce your risk. And that's why we're here today. All of those people who are here today have taken the step to, one of the steps to learn about falls and to reduce their risk. So getting informed is one of those things. So other fall facts, 1 in 3 older adults have a fall over 65, and half of those over 80 fall at least once a year. But again, as we said, they're not a normal part of aging, and there are things that you can do to reduce your risk. In women, another stat is women are more likely to fall than men, but men are more likely to experience a fatal fall. So they're thinking that men are more physically active, but they may be more likely to engage in riskier activities. So maybe going up on step ladders or doing some things outdoors. For women, they're not sure why women have falls more than men, but they're thinking that it's related to age-related frailty and restricted mobility and more frequent use of multiple medications, as well as having more incidents of osteoporosis. So why is it important to prevent falls? Why do falls matter? You think about the impact of a fall on your quality of life if you have an injury, and then the disability that might ensue, and then the potential loss of independence. As well, this can happen with near falls. So they need to be proactive to stay independent. So if someone falls, as this post-fall syndrome indicates, if you have a fall, you can lose your confidence, then it can restrict your activity, causing you to lose some mobility, to be a little bit less independent, just slightly. That could lead to another fall. So this vicious cycle can affect you, it can affect the people that are around you. So it can affect you as an individual, and it affect the people who are your caregivers or your family members if you become more dependent and less mobile. But we know from research that falls can be prevented. So why do people fall? Usually a fall is related to multiple risk factors or multiple reasons. It's never typically one single thing. It's an accumulation of a lot of possibly small things that can lead up to having that increased fall risk. So medical and health conditions, such as changes in vision, symptoms like dizziness and weakness, increase your risk for having a fall. Medications, certain medications, especially those for helping you to sleep, medications for mood or anxiety disorders, can increase your risk for falls. The more medication that you take, the more risk that you are for falls. So 4 or more medications can increase your risk. Poor nutrition as well. So not keeping your muscles and your body strong and active increases your risk. Lack of physical activity. So as a physiotherapist, this is one of the ones that I like to focus on, because there's so much that you can do, and adding exercise to reduce your risk for fall is the biggest thing that you can do to reduce your risk overall. Deconditioning can be a really big factor in risk for falls. So deconditioning, not maintaining your physical activity. So as you age through the 70s and the 80s into your 90s, you can lose muscle mass unless you take a step to do activities to maintain or improve your strength and your mobility. The environment can have a big effect on your risk for falls, especially living in Canada. You think of the winter itself can be a big risk factor and a big deterrent to getting exercise. Also, you think of stairs without railings, stairs that aren't well marked, poor lighting, using not having things within reach, so having to reach too high or too low, or using step ladders to get to them. Those are some of the environmental hazards that you may face. And then behaviors and choices. So this can be risky behavior by either doing something risky or avoiding the use of a gait aid to help you maintain your balance and mobility. Standing on chairs to get into cupboards, standing on step stools that aren't quite meant for standing on the top of, walking around in socks, as well as misuse of alcohol is another behavior that can increase your risk for falls. So there are some specific things for falls in people with dementia. The fall risk is increased, so there's a 60 to 80% chance of risk for falls. The mechanisms are not all understood for why there's this increased risk over another older adult, but there's likely a combination of factors. So changes in memory and attention can increase the risk for falls, as well as the lack of or the loss of ability to do some multitasking. For walking and balance, it's known in research that there are changes in mobility for years before there's actual diagnosis of dementia. It can go back 10 years before. And so these early changes can change the way someone is walking and balancing and recovering. There's also changes in motor learning. So you need to develop different strategies for learning different tasks, such as using a gait aid through the course of a dementia. Alrighty. So what you can do to reduce your risk. So there's a couple things on this slide. First is called the Staying Independent Checklist. And I'll show you the actual checklist on the next page. But this is a checklist that is made for people to do on their own. So patients, clients, This checklist is something that we use at the Ottawa Hospital and actually is being used in the whole of the Champlain LHIN. So you may see it at your doctor's office, at any medical offices, something that you can pick up and do yourself. So you go through this 12 statements and you answer yes or no. And I'll show you just in the next slide. If you score 4 points or more on this, it shows that you could have an increased risk for falls, and it prompts you to then go to see your family doctor to review. And as I'll show you, each statement explains why that issue is important to fall risk overall. The next thing is to manage your health and including your bone health. So you want to have regular doctor's visits with your healthcare provider. Make sure that any symptoms of dizziness, weakness are managed, that you go to see your doctor instead of ignoring them and letting things kind of catch up. You want to get your medication reviewed every year as well with your pharmacist or your family doctor. When you're reviewing your health with your doctor, it's medication. You want to think about your diet and activity as well, what you're able to do, what's safe for you, whatever monitoring you might need in your health and your activity. Every year, it would be a good idea to have some kind of a falls review with your primary care physician if there's risks for falls that are detected on the screening. So this is the screening. This is the staying independent checklist. So I know it's not that big, the wording, but I can read you the first couple. So the first question, or the first statement is, I have fallen in the last 6 months. If you answer yes, then you get 2 points. And this is important because if you've had a fall, one of the biggest risk factors for having a fall is having already had a fall. So if I see someone in the clinic, I can't do anything about the fall that they've had, but I can put in some of these recommendations after the assessment to help reduce the chance of the next fall, knowing that there's an increased risk. The second statement, I use or have been advised to use a cane or walker to get around safely. If you answer yes to this, you get a second 2 points. So there you've already had your 4 points. So your risk for falls, you may be at risk for falling, and so it prompts you to go and visit with your primary care physician. So it's important. The mobility piece is important because we know if someone has changes with their walking or their balance and they're needing to use a gait aid, that their risk for falling is increased. The third statement, sometimes I feel unsteady when I am walking, is so that's the feeling of unsteadiness or needing support, again, is a sign of balance. There's also a question regarding furniture walking, so holding onto furniture when walking at home. So that's related to the mobility piece. Some people are doing that without realizing it, but it is a sign of poor balance. An increased risk for falling using the furniture over using a gait aid. Fear of falling is a risk as well. If someone is certainly afraid of falling, it may reduce their mobility and cause them to be more deconditioned, creating an increased risk for falls. The other statements are related to rushing to the toilet, taking medications that make them feel lightheaded or more tired, increasing the risk, taking medication that helps you sleep, because obviously the side effects of a medication that helps you sleep is to make you sleepy. If you have to get up in the middle of the night, you're getting up with those medications in your system that are making you sleepy, but you need to get up and walk to the bathroom. So there's increased risk there, as well as medication side effects for medication if you're feeling sad or depressed, so medications for mood. So that's the screening. Other things that you can do for your health are to get your vision and hearing checked every year. There's lots of age-related changes in vision with older adults. They become more sensitive to glare, need more light to see at night. If you're over 60, you need 10 times more light to see at night than teenagers. So it's just something that's slow to change over time, something to be aware of. Takes your eyes longer to adjust with sudden light changes. So going from a really sunlit outside space to an inside space is going to take a little bit longer. So you might take a little bit more time before you take that first step in, especially if you're wearing sunglasses and you go from a really bright to really dark. You need some time to let your eyes adjust so that you don't step off a step or step in some place that's not safe. It's also changes in depth perception and distance. So just needing a little bit more time to scan the environment when you're walking on stairs and elevators and escalators. So it's important to get the eyes checked every year. Some diseases of the eye are very subtle, so there are no symptoms until there's nothing to be reversed, such as glaucoma. If someone wears bifocals or multifocals, this does increase your risk for falls. So if there's a way to avoid wearing the reading part, having two sets of glasses, one for reading and one for distance, that's ideal, but often that's not possible. So the suggestion is to then just be aware that wearing those glasses increases your risk. And so being extra cautious when you're going down and up curbs and on stairs, that you're really looking over the top of the glasses and taking your time to take those steps. Having night lights as well at night is a really important thing. Many older adults need to get up to the washroom at night, and you want to have the path slit free of any obstacles with the glasses on and the lights. Hearing as well is important to get checked on a regular basis. Every year is recommended. Wearing hearing aids as well to support your hearing will help to reduce your risk of falling. You want to protect your ears from loud noises. And researchers have found that people with hearing loss can be 3 times at more risk for falling. And the one thing is thought is with hearing loss, the loss of hearing imposes a more of a cognitive load, so a more thinking load, on a mental load on your mind, on your brain, so that you have less energy to work on maintaining your balance and your walking. So if you have to work less at hearing, then you can work more at the other things. So as far as medication, it's good to have a regular medical or medication check with a pharmacist on a regular basis, and asking specifically for what medications that you might be on that might increase your risk for falls. And can any of them be modified? Can any of them be changed, maybe adapted to a newer medication, especially if you've been on a medication for a while? With the research, there's a lot newer medications that have fewer side effects. So knowing that the more medications you want, the greater risk for falls, it's good to try to pare them down as much as possible with your pharmacist. It's good to also make sure that you're taking your medications properly. So at the right time of day. If you have trouble keeping your medications organized, then you can use a box just like on this image called the dosette. So it organizes the pills per day. If you have trouble, even more trouble, you can have them delivered from the pharmacy in blister packs, so that each time you take pills in the day is in a little bubble wrap, and you can just open it up and take the medications for that time. It's also important to never take anyone else's medications, anything prescribed for someone else, because depending on their age and the symptoms and what else you're taking, you might have some serious side effects. As well, when you're looking at the medication with the pharmacist, anything that you take to help you relax, to help you sleep, improve your mood, these are all increase your risk for falling. And many times these medications can't be changed, but it's just knowing that these medications do increase your risk. Also, if you drink alcohol or use cannabis, these things can increase your risk for falls. So if those things can be minimized as much as possible, it's ideal. As well, you want to keep your medications organized with one pharmacy. When you see medications that come with a disclaimer, you shouldn't drive with these medications, they cause drowsiness, those are the ones that increase your risk for fall. So those are the ones you want to be a bit more cautious of. This, even as well with, if you're taking antihistamines at this time of the year when there's a lot of allergies, you want to make sure you're taking one that's non-drowsy, because the drowsy part of the medication is one that's going to make you move slower and be more tired and increase your risk for a fall. So what you can do about dizziness. So if you have dizziness, you want to speak up about it. One of the most common reasons for dizziness is dehydration. Dehydration occurs when the body loses too much fluid and electrolytes that are required. And so that loss of those electrolytes and fluid in your body can make you dizzy, can make your blood pressure a bit lower. So ideally you want to stay hydrated, especially at this time of the year in the summer. You want to drink 6 to 8 glasses total fluid in a day. It can be water, it can be juice. It just doesn't include caffeinated drinks or alcohol. So 6 to 8 glasses a day. If you have heart failure or kidney disease and you're taking water pills, then you need to check with those doctors that are controlling those, helping with those diseases, to see whether this is an appropriate amount of fluid for you to have. There's some medications that can reduce your blood pressure and cause you to have some blood pressure changes when you're moving around. Some medications for depression and sleep and blood pressure medications can cause a drop in blood pressure when you move. And this drop in blood pressure is called postural hypotension. So postural related to your posture or movement, and hypotension, which is low blood pressure. So if you're having dizziness, it's something for your family doctor to check your blood pressure as you change positions to see if this is occurring with you. And then the things to do for that are to have the medication adjusted by your doctor if necessary, stay well hydrated, and to change positions slowly. So if someone with dementia, one of the things, they may need to be reminded to stay hydrated, but early in the day as well. You don't want to have those 6 to 8 cups of fluid after supper, because then you're going to have to go up to the bathroom in the night, and that's going to interrupt your sleep. So just constant reminders to get that fluid in through the day. So having water bottles handy, flavored water, juice if you're allowed, soup, fruit, those are all good sources of fluids. And as well, another conservative thing to do about dizziness, besides speaking up about it, is doing a little exercise before you change position. So if you've been lying down for a long time or sitting for a while, before you get up, you want to clench your fists and circle your ankles 10 times. So pumping your ankles gets the fluid moving back in your body. And so it's not going to be pooled in your ankles, causing you to have a little bit of a lower blood pressure. And then you want to change positions slowly. And then stand there for a minute, maybe moving your legs around still, but staying close to the chair. So if you do feel dizzy, you can sit down right away. If you feel dizzy, you can sit down and repeat it again, or lie down. Possibly get hydrated again before you get up. There are some different handouts that we have on postural hypotension. So if it's something that someone's interested, they can contact Herman and we can send those to you. Just a little booklet about the conservative things that you can do. In some cases, when people have that ongoing dizziness, they can wear compression stockings. So that helps to reduce the extra fluid that can accumulate in your ankles when you're not moving. But you need to make sure that you don't have circulation problems before wearing them or being prescribed them. So another thing that everybody can do, we all can do, is to eat a variety of healthy foods each day. So you want to eat a variety of foods so that your muscles stay healthy, your bones stay healthy. So having a variety for the bones, you want to have enough sources of calcium in your diet. Typically, we get sources of calcium in dairy products. If you don't eat dairy, then a lot of the non-dairy drinks are fortified with calcium. So the goal for healthy bones is 1,200 milligrams of calcium-rich food, or 1,200 milligrams of calcium in your food each day. Typically, if you do eat dairy products, then you can get 3 dairy product servings a day and get 75% of the calcium in your diet, and then the rest of the 25% you get in all the other foods that you would eat in the day. The other thing to go along with the calcium for bone health is vitamin D. In North America, because of the weather that we have, the long winters, it's recommended that North Americans have vitamin D supplements, because we don't get enough through the sun. And the recommendation from Osteoporosis Canada is between 800 to 2,000 international units of vitamin D. And you need to take that with a supplement. All right. So physical activity. This is where the fun begins for a physiotherapist. So It's important to have physical activity on a regular basis the whole time through as we age. So it's the most important thing you can do to reduce your risk of falling, reduce your risk of having any deconditioning, reduce the chances of having muscle mass that occurs with aging. So you need strong bones and muscles to keep fit, strong, flexible, and stable. So it does come down to the, if you don't use it, you lose it saying. So you need to be active to continue with your daily activities, such as walking, swimming, dancing. What they recommend from Health Canada is 150 minutes a week of regular aerobic physical activity. So aerobic activity is activity that gets your heart moving fast and gets you breathing faster. So aerobic activity can be walking, it can be dancing, it could be riding on a stationary bike or on a regular bike, it could be swimming. You can get this activity in 10-minute bouts. So 10 minutes is a minimum. So 15 10-minute bouts of activity. Or if you're able to do more, you could be doing 5 30-minute walks in a week. And then added to this, you need to add strength and balance. And those are the big components for fall prevention. So just doing regular walking on a regular basis isn't enough to reduce your risk for falls. You really need to add strength and balance exercises 2-3 times per week. This can be things that you do informally that might not seem like exercise, but are things that you do every day, like climbing up and down stairs. You can do sit to stand from a chair. And then you can do some other standing exercises at the kitchen sink. Or as well, it can be more formal, prescribed exercise. So for those things, you may need to see a physiotherapist if you have specific needs. If it's more general needs, then a lot of the programs that you can find online in the community post-COVID that we get back to provide some strength and balance exercises. The last thing related to physical activity is using a correct walking aid. If you have changes with your balance and your walking and you're starting to furniture walk, it might be time to consider why those things are happening. Is there anything that you can do to reverse the reason for those happening through strength and balance exercises, different shoes, etc.? Or you may need to use a walking aid. So physical activity is important because if you can't move, then you can't really do anything. You need to be somewhat physically active to be able to get off a toilet, get out of a car, do your housework, get yourself dressed. So physical activity is any movement that you're doing where you lose energy and you're using your muscles, you're moving your muscles in your joints. Exercise is more of a prescribed activity that's structured with repetitive movements with certain goals in mind. Activity is really important for many chronic conditions, such as arthritis in your hips and knees. So doing regular activities can keep the joints moving and keep them lubricated. It can also help with low back pain, a certain amount of regular mobility. It helps with fall prevention. If you have heart failure, there's a certain amount of activity that's beneficial. If you have heart disease, we all know that aerobic activity is really good to help keep the heart strong. As well with chronic fatigue, with diabetes, with mood disorder. So physical activity is really important. It's really important to keep maintaining as we age, maybe just adjusting what we do to suit our health conditions and our abilities. Exercise, this is one of the most impressive stats, is that exercise can reduce falls by between 13 and 40%. So it's one of the biggest things that you can do to reduce your risk for falls. So it's just finding out what the right amount is, what you can do. Again, for activity, the physical activity, if you don't move it, you lose it. So you need to be physically active for your daily activities, for things you enjoy, get your groceries in the house, for getting upstairs, and then for the basic activities of daily living. the toileting, getting in and out of a chair, going into the tub or shower. So it's really important to keep moving. If you have improved strength and balance, it makes these activities a little bit easier. It gives you a little bit more ability to do a little bit more than just the basics from day to day. It allows you to get out into the community. So this is a chart from the Champlain Lynn. You can see this on the Champlain Health Line. It organizes how the activities in the Champlain Lynn are set up for different people at different levels. So more and more programs in the Champlain Lynn are using this strategy. So the high level activity, won't really discuss too much here, but it's for people that don't have any worries about their balance. They're not worried about falling, they haven't fallen. The goals for them are to maintain or improve their fitness level. So in the clinic and for fall prevention, typically looking at the low and medium activity level. So medium activity level is someone who is worried about their balance. They may or may not have had a fall, but they're still fairly mobile, and the things that they're able to do are listed there in the middle. They can stand on one leg for 2 seconds. They can climb some stairs. They can stand for 20 minutes. Say if you're standing at the bank or in a grocery line, and they can walk a block without losing breath, without requiring them to sit down. So the goals of any activities at this level are improving strength and balance so you can move around more easily. In the Champlain Lynn and in Ottawa, we offer a program called Better Strength, Better Balance, which is a community-based program for people at this level. The goals are to improve your mobility, improve your balance, and reduce your fall risk. And the 4 criteria for that program are listed there. Right now, with COVID, this class isn't running. However, it is on Rogers TV every day, as well as on YouTube. So for people who are computer savvy, you can Google it or search it through YouTube and find a listing of Better Strength, Better Balance programs that you could then do at home. For the low activity level, this is the lowest level of this chart, and it's for people who had falls, they're afraid of falling, they have difficulty with their balance. They have difficulty getting out of a chair and walking, and in more cases, anyone at this level is needing a cane or a walker some of the time or all the time to get around. So the goal of this level is to be more mobile, steady, and to be more independent. The hopes that with enough activity and with an exercise that you could move up to the medium level. It's always the goal. And again, this exercise chart is on the Champlain Health Line. So activities at the low level include a new program to Rogers TV called Move and Improve. It's on daily on Rogers in English and soon in French. There's going to be a variety of classes, and these are chair-based exercise classes with some exercises standing, holding on to a chair or holding on to a walker or a kitchen sink. Some other programs at this level that you could do now are one's called SAIL, so S-A-I-L, Strategies and Activities for Independent Living. This is from a program from Finding Balance BC, and there's 3 different levels. And of note too, this program is offered in 4 languages. So there's little videos that would explain the exercises. There's sheets that could be printed up. And there's a lot of help on that website. So here are some extra ideas kind of put together for things that could be done, because now everything has to be home-based instead of community-based. So TV programs, the Better Strength, Better Balance is on TV, on Rogers TV, as well as you could find on YouTube. This Move and Improve class is on Rogers as well. It's a low class. As well, there's an older version of the Move and Improve on the Regional Geriatric Programs website. There's a link to that, and it's just in English. There's other online programs. I mentioned the SAIL program. So this is a program from out west. There's Let's Get Moving Online, which is a program through the Dementia Society. It's a weekly chair exercise program for persons with dementia and their caregivers, and that's through the internet, through YouTube. There's as well the MotiveU pedal power program. So using pedix, so part of a bicycle that sits on the floor, and you put your feet in and you can pedal in a regular chair. It's another way to get some aerobic exercise. And if you add a little bit of resistance, you can get a bit of strength in your legs. And the Dementia Society runs a program so you can cycle while watching a video link to a cycling abroad. So you can actually watch yourself cycling through Europe. They have these bikes on loan from the Dementia Society. You can find that information on their website. There's also just functional activities. Sometimes the people that I see aren't interested in a formal exercise program, but they may be interested in doing kind of a few sporadic exercises throughout the day. So sit to stand is a very good exercise, very functional, because you need to sit to get off the toilet, out of a chair. You can do sit to stand in different ways. So if you're sitting, if you're able to get out of the chair without your arms, then you could do that, and you could do a few in a row as an exercise, sitting to standing to sitting, and trying to change the speed. So doing it a little bit slower to make it a little harder for your muscles. Using stairs, if they're safe to do, always with a railing, is another way to work on some maintaining, improving some of the strength in your legs and strength and endurance. Gardening is another informal activity that's good for working on your balance because you're doing reaching and stretching. Walking with some challenges can be a good functional activity. Marching on the spot, again, lifting your knees up higher, lower, walking with your feet wider together, or changing up the speed. Doing laundry, there's lots of bending and reaching. Other somewhat formal exercises, but standing at the kitchen sink while you're standing there, doing some heel raises or toe raises or leg lifts. And then as well, using the pedix or a stationary bike. So coming to walking aids, why are walking aids important? They're really important to help maintain mobility, stability, and safety. They can improve your walking quality. So oftentimes people may be able to walk a little bit without a gait aid, and you give them a gait aid, and it improves the quality tremendously. It allows them to have a normal pattern of walking. All those abnormalities in a gait pattern or a walking pattern, they increase your risk for falling. So if your stride isn't symmetrical, if you're scuffing your heels a bit, all those little things increase your risk for falling. With a gait aid, if you can reduce some of those, then you can improve normal walking patterns rather than work like impressing upon poor habits. A gait aid can also improve and enhance your endurance because it reduces the amount of workload that you have to do, and as well provides you a place to sit. If you're using a walker, provides you a place to sit and rest during your walk. It allows people to get outdoors and able to go a lot further with their endurance. Using a gait aid, such as a walker or cane or walking poles, can reduce pain by taking some of the workload or the weight off of a sore joint or muscle. So if you have a sore hip or knee, using a cane on the opposite side and learning to walk with it properly can help you maintain a more normal walking pattern, as well as taking off the weight off of that limb, and can reduce you having a limp. So making a smoother step pattern, reducing the strain. For someone with dementia, the use of a gait aid, it could increase their risk for falls with the use of it, but they can learn through repetitive movements to practice those areas that are most difficult. So learning through repetition and reinforcement and practice is the best way to have someone with dementia get to using a gait aid and be more comfortable with it. So practice, 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 as well as looking at specifically what the areas are that are difficult to do. Is it and difficult to remember? Is it difficult using the brakes on the walker every time you go to turn around and sit on the walker? Is it opening up a door that opens towards you or opening away from you? And then it's working on those things and practicing those things over and over so that there is more muscle memory to doing the activity the correct way. So do you need a walker? How do you know if you need a walker or a cane or walking poles? These questions to ask are, do you have concerns about your balance? Are you reaching for furniture or walls for support? Do you have trouble stepping up to a curb or down from a curb? Do you have leg pain, which affects your walking? So if you have yes to any of these, then it might be something to consider having a cane or walker, walking poles to help you. A physiotherapist assessment is recommended, at least even one assessment, to get some training to use the walking aid so that you don't develop some poor patterns from the very beginning, and you develop a lot of safe practices. So safe use of the walker, if it's the brakes, if it's backing up, if it's using the seat, as well as safe use of the cane, the proper height, the proper stepping, because there's a few cues that could save you a lot of grief later on. Canes are available at most pharmacies. You can buy canes of different types of handles, depending on, really, it's more of a personal thing. If you want a curved handle like in the image, or a flat handle. If you have a flat handle, then there's a bend in the cane to provide that. Some canes have a larger base, so they, like a clover leaf, so they'll stand up on their own. Still not too steady, but they'll stand up if you let go. Walking poles as well, you can get them sometimes at pharmacies, but at many of the outdoor sporting stores. If you're going to consider the walking poles, there are some classes throughout the city. People do some Nordic walking that you might consider to learn how to use them well. They're being used a lot more with people who have back pain or have had back surgery, because it helps to adjust your posture a bit and take a little bit of a load off the back. So next thing, footwear. So footwear is important. Obviously, if you're wearing the wrong shoes, if you're wearing high heels, women are wearing high heels, slippery shoes, flip-flops. There's some more obvious reasons why those things increase your risk for falls, and the research does support that. So wearing the right shoes will reduce your risk for falling. And when you're looking at a pair of shoes, there's a couple main features that you want to look at. You want to have a shoe with a low, wide heel. You don't want the heel height more than about an inch. You want to have a back to the shoe. If the shoe doesn't have a back and you can slip it on and off, then it can slip on and off when you're up and down stairs or walking. So a shoe that hugs your heel, gives you that heel counter support, can help you with your balance. With those little side-to-side movements that we do when we're walking, the shoe can give you some support. You want a shoe that laces or velcros so that you have a snug fit and your foot doesn't move around in the shoe. When you're looking at the sole, you want to have some kind of a grip so it's non-slip, but you don't want to stick to carpet. So this is more personal when you're walking. You want to make sure that the shoe doesn't grip, causing your feet to stop and your body to continue on. And you want to have as well a toe area that fits. You want the length to be a little bit longer than your largest toe. So those are more fit issues. As well, if you pick up a shoe, you don't want to be able to wring it out. You want to have a little bit of stiffness across the forefoot of the shoe. If you can wring out the shoe, if you can fold the toe to the heel, the shoe is too flexible. It's not going to offer you much support. And there's a lot of really lightweight shoes on the market that you can wring out, that you can bend and forward and back, and they're not providing a lot of support. They protect your foot, but they don't provide a lot of support. So the best type of shoe is a shoe that's like a sneaker, like a walking shoe, like a running shoe. Those are the best shoes to choose to reduce your risk for falls. And this is a shoe, these are recommendations for shoes that you wear inside and outside, not just outside. One other thing to consider for footwear when you're outside is winter boots. What are you going to wear on your feet in the winter? You want to think about similar things. You want to have a good strong heel counter at the back. You want to have a low heel or a low heel and a good solid grip on the bottom. You can also try putting ice grips on the bottom of your shoes, ones that you slip over the shoe to give you some support, like Stabilizers that are sold, Lee Valley sells them and Mex sells them as well. So they're ones that you put on and off. The difficulty with those is if you're just not going for a walk and ending up at your house, if you get to a store, then you'd have to take them off at the other end, and that can prove difficult. So they're more for just walking, say, to get your mail and come back home, and then you can take them off at your home sitting down. The other thing for winter boots is to look at what's recommended on a website called ratemytreads.com. So it's a research facility in Toronto that looks at winter boots and tests them on different surfaces, or up an incline and a decline that's icy, and rates them with 1, 2, 3, or 4 snowflakes as to how fall or how steady they are on ice. So it's a standardized assessment rather than just a claim by a company saying that their shoes are good or their boots are good in the winter. In the winter, if you're just having short distance to walk, say to your car, and there's going to be ice, you can carry a little bit of sand and throw it out to help you reduce the risk. As well, putting an ice pick on a cane and using that to give you a little bit of support will be also helpful to reduce the risk underfoot. So there are a lot of environmental hazards. In these two situations, both of these people have both of their hands, occupied with things. The one man on the left is carrying something in his left and a cup in his right, and in the second picture, he's got both hands occupied as well as he's distracted. So you want to kind of watch your step, pay close attention. You want to make sure that you clear the path where you're walking as much as possible, especially if you have those risks, if you have a risk for falls. Using the gait aids, if you're using a gait aid, you want to have a little bit extra space, especially in your home. You want to avoid using step stools. You want to have good lighting, especially when it turns dusk, to have the lights on in the home and good contrast. All stairs should have railings inside and out so that you're not going up and down. And it's best to use a railing and only carry what you can in one hand, just to be careful, especially up and down the stairs carrying laundry. It's good to be able to figure out how you can carry it so that you always have one hand on the railing. And that might mean putting some kind of other handles on the laundry basket so that it can be carried over your shoulder, to be carried with one hand, or some kind of a backpack or something like that. So it's something to problem solve. The laundry can be a big concern, getting it up and down the stairs. Winter is an issue for environmental hazards. So we talked about wearing boots that have a rating for fall risk reduction or slip reduction, using sand more often outside of a lot of the stores. In the winter, there's boxes of sand that you can put out, reporting any environmental hazardous conditions on the sidewalks to the City of Ottawa. There's a couple other programs in the city where they have people doing some of those assessments and reporting back to the Council on Aging on the sidewalk conditions, so that the city puts a bit more attention to some of those areas. For someone with dementia, one of the big things is to think about contrast sensitivity or lack of it. So having more contrast in areas in the environment to improve the visibility. So having tape on the edges of stairs so that you actually see where the stairs are and where the last stair is. Having the handrails marked, maybe edges of chairs. If someone's missing the chair, having edges or the arms of the chairs marked with tape so they can see. Same thing in the shower, seeing where the edges of the shower for support, having a bit of contrast. Possibly with the use of a walker, having little signs on the walker as reminders for using the brakes so that you're not having the walker slip away. So having a sign on the walker seat saying to use the brakes with lots of repetition can be helpful. Oops. All right, as well in the home, for environmental hazards, you want to avoid clutter. So you want to be able to walk through easily with a cane, with a walker, or without having to walk around. things that you might trip on, little dog toys as well. You want to avoid having lots of scatter mats. So it's better to have just one type of flooring and no rugs that curl up on the edges or move when you stand on them. You want to avoid wires that are going to be in the way where you can catch your foot and trip. And then as well, good lighting. So night lights on at night, proper lights on, like big lights on during the day and at dusk, so that there's no issues with the contrast and there's no extra shadows. Stairs and steps with railings that are in good condition without broken pieces, so that it's safe to go up and down. And then think about other special things inside and outside. So there is a home safety checklist on, if you go to stopfalls.ca, it's one of the websites I'll show you at the end, and there's a home safety checklist. So you can go through your own home, kind of room by room, and look at things with the lens of fall prevention. So looking at how the chairs are set up. If you're using a walker, then you want to be able to walk past a chair that you're going to sit on and turn and step back to it, rather than backing up through a long, narrow spot between chairs. So it may mean moving things around. Looking at your bathroom, having bars that are meant to be held as grab bars to get in and out of the tub. So it shows some of the installation spots for some of those things, having bars where appropriate. Talks about getting on and off the toilet. If you need some help, what you could do with bars or a raised toilet seat. So it's a bit of a checklist, and everyone can go through their own situation. So this is a Public Health Agency of Canada photo to show fall risk as well as just general safety risks. So many of these risks here aren't for falls, they're just risks, fire risk or possibly medication risk. So the main ones for falls would be that there's no railings on the stairs. You look at the footwear on the woman coming down the stairs and the man sitting in the chair are the slip-on flip-flop slipper, which itself is a fall risk. There's a rug there at the bottom of the stairs that could move when this woman finishes walking down. Also, there's a rug with a corner turned up by the man sitting in the chair. There's lots of cords that could tripped on. There's a few other risks related to fire, medication, clutter, the spilling of the coffee causing a slip hazard. So there's a lot of things in here that aren't recommended. Of course, this is an exaggeration, but these are some of the things when people do home visits, they do find some of these things. For the man sitting at the table or sitting in the chair, sorry, the telephone is out of reach. So if there was an emergency, you'd have to still get up. So having something handy would be a little bit better. So this is a falls action plan. This is kind of a little bit of all of what I've spoken about all put together. So you can make your own plan and if you look at the staying independent checklist and see where some of the risks are and you review with your family doctor, then you can make a plan for where you need to make a change and reminders to make those changes. So if it's a regular medical checkup, you can try to schedule that. If it's getting some physical activity, putting in a plan to get a little bit more activity each week. And if you're not doing near 150 minutes a week, then having a plan that maybe you're going to do an extra 10 minutes per week, and you're going to gradually work over the next month to get a few more minutes in your day of exercise. Looking at eating a variety of healthy foods, wearing the supportive footwear, which is can be an easier win to do, easier to maybe change your footwear than to change your physical activity right away. Avoiding risk behavior, so looking at what you're doing. Is there a way to do what you're doing in the home safer? If that's where you want to stay and age in place, then thinking about maybe it's time to get someone else to get up on the ladders to clean out the gutters on the house. So it's good to have a bit of a plan and an organized plan. If you do have a fall, first of all, you don't want to panic. You want to kind of just determine if you feel that you're injured or not. So give yourself a bit of time, move your arms and your legs a little bit and see how you feel. If you feel that you're not injured, then you may want to try to see if you can get up, you know, with or without any help that's around. So ideally you want to go from, if you're on your bottom, to roll onto your hands and knees. And then if you're able to crawl to a table or a chair or a couch to help yourself get up. Now, if anyone is working with in a gym or working with a trainer or a physiotherapist, this is something that can be practiced, actually getting down and then getting up from the floor. So kind of doing it in reverse to get some practice. Working on some of the parts of this can improve the overall ability to get up on your own. If you're not able to get up or if you're injured, then you want to try to call for help and then just wait. You want to try to keep yourself warm. If your bladder lets go, you want to try to move away from it. And you want to try to move your limbs every once in a while and move your position every once in a while. So there's no one part of your body that's got that pressure from lying down for a long time. If you end up being on the ground for a few hours, you want to just move around so you avoid pressure areas and muscle damage from being down. For someone who does live alone and there is a higher risk for falls, then having a personal alarm system that has a fall detector built into it would be a good idea. So if there's a fall that's registered, you would get a call. And if you're not responding to that call, then they would assume that something's happened and they would, you know, call 911 and you would get help arriving at your house. Because many times there can be minor injuries from a fall, but there can be major injuries or major damage to the muscle by being on the ground for hours and hours and hours. If someone does fall, it's a good idea to avoid lifting them up to help them get up. So we want to avoid helping your partner if they've fallen or someone else who's fallen get up, because you don't want to get yourself injured. So it's good to get some help from professional help or neighbors, more people to help someone get up so that there's less lifting and more just helping. So if you've had a fall, it's a good idea to tell your healthcare provider and your family member. Because if you've had a fall and there aren't any consequences, then it's a really good time to look at why you might have fallen. A lot of people say, oh, it was just the curb or it was just the ice. But some of those situations, if that had happened 10 years before, you might have had a little bit of a slip, but you might not have fallen. So what's happened in those last 10 years to increase those chances of your falling? And then what can you do about some of those things? If you have any healthcare conditions that might increase your risk, if you've had a loss of consciousness with your fall, then it's a good idea to see a healthcare provider. If you have a strong or lingering pain after a fall, it's a good idea to see someone as well. If you had dizziness, nausea, overall weakness or unsteadiness, headaches, vision changes, drowsiness. If you've had an injury to your head, it's a really good time to see a healthcare provider. If you can't right away, then you might be an emergency visit just to make sure that you haven't had a serious injury. Because falls can act as a red flag. It can be sometimes related to another medical condition that shows itself as a fall. It could be a urinary tract infection that results in a fall. It could be a low blood sugar. So it's good to tell your healthcare provider, tell your family so that they know if it happens again, and then you can get things checked out. So in summary, the one big thing that you can do to reduce your risk for falls is exercise and more exercise with a focus on balance and strength exercises. Activity is important, such as walking, stairs, and gardening. So it's important to keep active, to keep conditioned, so your muscles are used to that activity and you have the endurance to get through. Footwear is something that's easier to change, and to know about wearing supportive footwear so you can review what you're wearing and save the fancier shoes that maybe don't meet these criteria for some of those more infrequent situations, and wear the supportive footwear more of the time. Environment is important to make some small adaptations to your abilities. So having the right equipment in your bathroom, even the equipment before you might think you need it, so it's there when you do. Changing some minor things in your home, the rugs, the lighting, having handrails, having steps marked, and then making some adaptations so that you can manage in the Canadian winter outside. Having a medication review is important, so knowing what medications that you are taking that increase your risk for falls, can any of them be adjusted, and if not, just knowing that you have those risks. And then nutrition and hydration, so getting enough fluids in the day to reduce the chance of having the changes in your blood pressure, and then good nutrition so that you're maintaining your weight and maintaining your muscle and bone health. And then vision as well, making sure that you get your vision checked on a regular basis, wearing the glasses is appropriate, being cautious with the bifocals, and being cautious with changes in lighting in and outside, just giving your eyes the time to adapt. So here's some of the more common fall prevention websites that we use. Fallsloop.com has a section for healthcare providers and for clients. StopFalls.ca will lead you to the Regional Geriatric Program's fall prevention section of their website. And then there's a lot of information as well on Finding Balance Ontario and Finding Balance BC. A lot of information on all the different sections that we've talked about. And the Champlain Healthline has a link to the chart that organizes the fall prevention activities and exercise programs into low, medium, high, so you can find out what exercise program is right for you, as well as a lot of other fall prevention resources and exercise programs. So in conclusion, falls are not a normal part of aging, and many falls are preventable, and many things can be done to reduce your risk. Most falls are multifactorial, meaning that there's many things that contribute to that fall, and so many things need to be done to reduce the chance of having another fall. So it's important to report a fall, a near fall or a stumble. So tell someone so someone knows, and then you can get the appropriate help to reduce your chance of falling and improve the chances of healthy aging. So you need to take action to identify your risk factors and to make a plan. And that's it for today.